There's been a massive drop in the number of young women diagnosed with cervical cancer.
Yeah, according to new research from the American Cancer Society, the rate of cervical cancer in women aged 20 to 24 dropped by 65% from 2012 to 2019. Now, deaths are also down by a third in the past few decades.
Joining us now to talk about what is driving this positive news out there, Dr. William DeHut, the Chief Scientific Officer at the American Cancer Society. Doctor, thanks for being with us this afternoon.
Yeah, happy to be here.
Well, so
it's a great day.
Let's start with this. Why do we think there has been such a recent drop in cervical cancer deaths and rates?
Well, I think a lot of it is a timing based actually on the HPV vaccine.
Okay.
In 2006, the FDA approved HPV vaccine for the two strains that cause 70% of cervical cancer. And since that time, we've seen this decrease, which is much more rapid than decrease we'd seen earlier when we'd seen a decrease simply due to increased screening. So I think it's really great news.
Okay, so doctor, through your research and information, you're also able to estimate how many women will be diagnosed this year. What did you find?
Well, we still anticipate about 13,960 women. So that's actually too many. And there's actually a fairly high divergence between vaccination from state to state. States in the Northeast, like New York and Rhode Island, quite high. Other places like West Virginia, not so good. So we really want vaccination to be much higher across the country.
Sure. Well, besides helping to prevent cervical cancer, why is that vaccine so important?
Well, cervical cancer is not the only cancer it can help prevent. Actually, HPV has an impact on head and neck cancers as well as on anal cancers, and also may prevent some of the viral inflammation and growths that occur in women. So I think it's actually important for many reasons.
So, doctor, speaking of the vaccine, we know that some women cannot get the HPV vaccine. So is there anything else that they can do to prevent cervical cancer?
Well, I think, first of all, we should talk about screening. American Cancer Society recommends that women 25 and above actually have an HPV test done every 5 years. If that test shows something abnormal, then one will undergo a colposcopy, which is an examination. And it's possible at that time, if there's actually signs of risk for cancer, then a minor surgical procedure can be done to prevent it. And then any sort of barrier methods that can be done can actually also prevent any diseases that can be prevented sexually. So I think those are two things we'd certainly recommend.
All right, let's talk about the research you have that found that prostate cancer, which we know is the second leading cause of cancer deaths for men, increased after decades of decline that we were seeing. Why do you think that is?
Well, we really saw a change in screening patterns starting probably around 2008 to 2012. So what we saw then was there was initial recommendations by some organizations to actually not have patients undergo screening. So naturally, you saw a decrease in cancers that were detected. But what's most concerning now is not that cancers are increasing, but it's the type of cancers. So we're seeing an increase of about 4 to 5% a year of advanced cancers. And so we've seen a doubling of that. We know prostate cancer early on is very treatable and actually curable, but advanced cancer and metastatic cancer is not. So that's what's really concerning about these numbers is not simply the incidence increase, but the increased rate over time and doubling over time of more advanced prostate cancers.
Okay, so doctor, what else do you want men to know about prostate cancer prevention?
Well, I think it may be hard to prevent, but if we catch it early, it can be treated or certainly observed. So talk to your physician about getting a PSA test. That information can drive you whether or not you need a biopsy. And not all prostate cancers need to be treated right away. So don't be afraid of information. Don't be afraid of finding out what's going on, because that's the best way to prevent the cancer that we really can't treat. It's incurable.
All right, Dr. DeHut, thanks so much for joining us this afternoon to talk about this all-important issue.
Yeah, thanks very much for having me.
All right, you can read the full report and also find resources and support online at cancer.org.